Let's start then. Good afternoon, or is it morning still, ladies and gentlemen? Our sincere apologies for the delayed start. We had to make sure that the information that we're giving out is accurate. So as we're doing that, that caused us the delay. But we are now ready to start. Today, the briefing will be led by the MEC for Health, Dr. Bandile Masuku, and the head of the Department of Education, Edward Musue, will deal with the part on education. I would like to call upon the MEC to start the briefing. I see we're still sorting out a minor technical glitch here, so just give us a few seconds to sort it out. All right. Yeah, that's what I wanted. I wanted to bring the right one. Okay, we're fine now. Yeah. Okay, we're ready to start now. Let me see.
All peoples. Thank you and good morning to all Gautengers and South Africans, and also further welcome you to our weekly media update, which we have been having for the past 20 weeks, where we give our feedback on the work that we have been doing in terms of the response to the pandemic. This week, we are not joined by the MECs mainly, particularly the one from the Department of Health, MEC of Education, Mr. Panyaza Lusufi, who has attended a funeral of one of our legislature members, our MPLs, the late Honorable Mapiti Matsena, who is laid to rest in his hometown in Limpopo. We also today welcoming back the Premier to full health. He'll be joining us in the coming week when we do our weekly media update. He has actually, probably we can say he has recovered completely, and we are just trying to onboard him on the latest that we have been doing, and he will be coming on board in the coming week or so. Like I've said, this is a 20th week of the response to the pandemic, And we've been quite open and transparent with all what we've been doing as the Gauteng Provincial Government. And this we have repeated in all earnest, that these are the 6 pillars that our response is actually based on. And we have been working on all these 6 pillars ever since. The one important fact that we also want to mention is that our work is not without any faults, and we are continuously improving our systems and improving the response to make sure that it becomes so much accurate and precise and decisive in most aspects. We must also accept that it has not been a very easy time as the pandemic evolves and as situation evolves in the country. We had to also make sure that the response remains relevant. This is the start, what we normally present, which is a national picture, which is the picture that usually is presented by the national minister through the NICD, which all of us receive before we sleep every night. And it just gives us an indication that South Africa has become within the top 5 of the countries that has got confirmed cases and active cases internationally. And we've got 408 or so confirmed cases, with almost half of that of those patients having been recovered. And our number of deaths is 6,093, which is something of worry because we don't want to be losing lives unnecessarily. And every life does matter in this regard, and we are in the business of saving lives. So the response also has to look at all the aspects of making sure that we do have adequate staff, adequate beds, and adequate resources to make sure that we are able to save lives. It's also important that we mention in this regard that the tests that have been conducted have passed the 2.5 million mark, and it's something that we appreciate in terms of the capacity that our laboratory services have been able to put up going forward. This is just a graphical representation of what the picture I've shown you in the previous slide. You will realize and also make sure that you understand that as of now, Gauteng is an epicenter, and we said it before that we are now in the middle of the storm, and 36 or so confirmed cases, 36 or so, 36% of all the cases in the country are found in Gauteng, and over 42% of active cases are found in Gauteng. And this is a figure that makes us the epicenter and also makes us the whole attention of the pandemic coming to actually Gauteng. This is the number of the recoveries. We want to also indicate to you that our recoveries have been increasing quite nicely in terms of the numbers that we have been having. At the current rate, we are almost at 77,000 recoveries, which is closer to our half, almost 52% of all the confirmed cases in the country. But in terms of our contribution to recoveries in the country, we are now, the leading in terms of the recoveries, because of 33% of all recoveries are coming from Gauteng. In terms of deaths, like I've said, these are regrettable deaths, and we normally want to express our condolences to the families and friends and colleagues of all those who have lost their loved ones, and also in this point appreciate the role that is played by our healthcare workers who took effort and make sure that they tried to save lives, and we like to appreciate their effort and also indicate our appreciation in that regard. This is a graph that we normally show you, which clearly demonstrates how the pandemic is evolving in Gauteng, and you will realize from the past weeks we were worried on how the green graph was actually moving away from the pink graph being the active cases, And now you see that it started now to show and become what we really want to see, you know, which the green graph, which is recoveries, representing recoveries, starting to be more than or even go further from the active cases. And the point of intersection for us, it gives us a bit of hope and excitement that yes, indeed, this virus or this pandemic can be beaten because the majority of those who are infected, they do recover and without many of the sequelae problems. And this is how we are looking at it now, and it's quite hopeful. It gives us hope and courage that we should be doing more and putting more interventions in making sure that this green graph does approach also even the blue graph, which is something that we are hoping to see in the coming weeks or months forward. This is the number of cases. Now in this point, we compare from previous week to the current week. And just to emphasize the point in terms of the confirmed cases, you'll see our increase has been very drastically up from last week. Last week we were on 117,000 cases. Today we're on 148,000 cases. And also of importance is we have increased in terms of active cases to around 70,000 from around 65,000. And in terms of recoveries, we also have increased tremendously, which is one thing that I've indicated before, that it gives us hope and it gives us courage on how we can be able to defeat the pandemic and defeat the virus. And the more the recoveries, the more we are actually giving hope and courage in that regard. The death still the mortality rate still is around 1%, which is something that we'd want to keep it there, though any life lost is a regrettable point, and we like to express our condolences in that regard. This is a graphical picture of the new cases per day. You will see how our graph is looking at, and we are hoping that this graph will maintain its downward stride. We are not yet excited about the downward stride because it's not really saying that the pandemic or we are over the peak. It just means that most of the efforts that have been put in are working, and we just need to continue to put more efforts and interventions to make sure that the downward trend gets sustainable, and it's something that we are looking forward to. So not to belabor the point, you will see that ever since we had our highest point, highest number of daily increases, which was 6,531 on the 9th of July, we have never seen such a spike ever. And we did have one of the lowest on the 20th of July, where we had one of our lowest daily increase, which was around 3,000. But it's a pattern that we are observing, and it's something that also gives us courage and strength to make sure that we are able to move in this regard. This is the next one, which is the regional breakdown, like in terms of representing what our regions, our districts in Gauteng have. We do have 5 districts, and Johannesburg remains one of the highest. In essence, what we normally say that 85% of all the activity of the pandemic, you find them in the metros, the 3 metros in the province, Johannesburg, Ekurhuleni, and Tshwane. Our worry is just to see the number of active cases in Sidibeng, which in terms of the per capita in population, it's something that worries us. We are, like always, having to work with NICD to try and get rid and make sure that we're able to reduce the number of the unallocated actual figures, which also continues to rise, and it becomes a worry point. And as the data continues to be cleaned up and processed, and unallocated figures, we expect them to actually be lower. This is in terms of the sub-districts. You'll see that the sub-districts that have got the highest cases are found in Johannesburg, and this is one of the things that made us to even take an effort from the side of the command center and the nerve center of the public health response to visit one of the areas which we found to be very problematic in terms of active cases, and we will give report as we go on on what we found and how we're going to be moving forward in that regard in terms of ward-based approach and activation. This is in terms of the highest confirmed cases and active cases per district. Like I've said, Johannesburg still remains the highest in this point. The next slide will actually talk to the highest number of recoveries, which is, before that, maybe just to talk about the highest number of active cases, which will be in Johannesburg, and followed by worryingly, like I've said, by Mfuleni, which is in terms of the per capita population, it's something that has to be sorted out, and we will have to visit them and see how we can be able to put in some intervention to make sure that we are able to control the spread in that area of Mfuleni. This is just the highest number of recoveries. As we have indicated, that we are going to be seeing more recoveries in the coming weeks, because the number of those who are hospitalized still remains pretty much constant within what we have been expecting in terms of the percentage, and those who in the main are recovering are those who've got mild and even actually moderate symptoms. But it's important to maintain and also say that yes, we do have discharges. People do leave our hospitals alive. Even those who are in the highest group of risk, the highest risk group, they do get actually discharged, and they do recover. This is the daily increase in terms of the cases per sub-districts, which is something that we normally demonstrate to check where the hotspots or the areas where we need to put focus on. This is just the breakdown on the death in terms of demographics, in terms of gender. Like I've said, the area that is a big problem is the one on the age group 50 to 80, which is becoming a big problem. Like I said, but we do have some people and who have been infected who recover, even though they are within that high risk group. The next slide just talks about the comorbidities and the days that comorbidities that we have. You'll see, like we have demonstrated, that hypertension alone is a big problem. Hypertension, diabetes alone is a problem, and combined, the bulk or the majority of all our patients who have passed on, they are actually having all these comorbidities of hypertension and diabetes, which is something that means that there are some of the aspects that we need to look at in terms of our lifestyle or non-communicable diseases actually going forward. This is the days of the number of days of people who have passed on, the number of days that they've spent from diagnosis to the death. You will see the majority of them still remain between 1 to 3 days, which is a good indication of us, people not seeking help quite early, coming to hospital whilst everything is almost late and the complications are difficult to manage. One of the things that we have appreciated about the management of patients with COVID-19 is early intervention, and it's early actual management that is required. That is the reason why it's so important for us to make sure that those who require help urgently, they do get it. And we know oxygen, IV fluids, intravenous fluids, and also some anticoagulants, they do come in handy in this regard. Maybe just to also mention, whilst we are here, that we are dealing with a number of individuals, a company that is bringing remdesivir into the country, one of the drugs that has been licensed and has been seen to be quite beneficial in treating patients with COVID-19. And we are working with them on how we can bring in more stock and be able to utilize that stock within our hospital so that we're able to save lives. The dexamethasone has been used, and we are continuing to use it. Hence, I think it contributes to the low number of our mortality rate in this space. This is a slide that deals with the number of our provincial figures. Like I've said, next week when we come together, we will clearly be over 1 million tests, which will be a very big milestone. that in 20 weeks, as a province, we're able to test over 1 million people, or having had 1 million instances of testing, which is something that is a remarkable feat in this regard. And Gauteng still remains the bulk contributor to this one. And the more we test, the more we reduce the productive rate, and how we actually determine the positivity rate that we need to actually lower and continue to lower. So the more the test we do, the more we know the status of individuals, the better. But also in this regard, it's important to mention that we have changed our strategy in terms of testing. Those who are tested now, in essence, are those who are in hospital and our healthcare workers who are the most highly infected in this regard. And it's something that is important that we emphasize, that our testing approach has been changed, because we will also still want to save and reserve the testing kits, particularly for those who will require and need it, particularly those who are symptomatic and who require hospitalization or medical help. This is just a scenario which in the coming week we're going to share with you the progress that we've made in the past 2 months between June and July, and see how far we are. But this is just what we've been using as a basis for our planning and our basis of our resourcing of the department. It also speaks to where the peak would be, which we have always said that it will be towards mid-August, towards the end of September, and hopefully as we are in the middle of the storm, when we get there, we would be having enough experience in dealing with the pressure and the stress that comes with dealing with the storm. The next slide just deals with the number of infrastructure beds that we have put in. Last week, you'll recall that we had over 8,700 beds, but in the past week, we have added a couple of beds, including the ones in the field hospitals. You see there the additional field hospitals that are continuing to be added. We're looking at Nasrec, which it's one of our field hospitals, and we need to be very proud to indicate that the beds that we are adding in Nasrec, they do have a capacity to be escalated, to give oxygen, and also to be able to give some intermediate care in this regard. And work will be starting in earnest in Tshwane to make sure that we continue to add these beds. And as yesterday we welcome the additional boost in terms of resources that have been allocated to the fight against the pandemic. But this is just an indication of what we have been putting up in the space. This is the work that will be there, that is continuing in terms of the ABT, Alternative Building Technology, which is a word that will be repurposed going forward. This slide, you will see how different it looks from what it was before, but it's just an indication from our point of view of the number of patients that are in our hospitals in the public sector, and those who are in the private sector, and those who are in high care and high care and intensive care units. And these are patients that require more attention and that we are continuing to observe and actually monitor. This number is becoming, I think from last week, what we had was around 5,000 or so, 700, and now we're on actually 7,000, just as an indication of the pressure and the intensity that we are feeling in our facilities. In this regard, we are perfecting, like I've reported 3 weeks ago, that we are having a bed management team that every day, every morning, every night, they do a bed count and make sure that we're able to direct the traffic and to direct the traffic flow of the patients where they should be admitted. I think the most frustrating part would be that when people require a bed and they might not be able to find it, but this team makes it easier for us to manage that particular aspect. At the current moment, the EMS is the one that is doing it quite well, and we are continuing to utilize that aspect. This slide just indicates the number of the public servants in Gauteng that have tested positive, and you see the number continues to go up because these public servants, they do stay in the communities and they will be affected by some of it. I know that I did indicate last week that most of our public healthcare workers who were found to be positive in 3 institutions are people that were not working directly in COVID wards, but working in the facilities themselves. And that doesn't suggest that we mean that they've not gotten infected from where they work in the hospitals or clinics, but it's just an indication of the survey that has been done in those particular facilities, where the majority of those who were found to be positive are not those who are working in the COVID wards, but are those who are working in other wards and in other areas in our facilities. So we are not downplaying the issue and the importance of us as government to provide adequate training and adequate PPE of quality. Yes, I did indicate last week that we are now dealing not only with the numbers of the quantity of the PPE, but just to continue to improve the quality actually thereof. And we do welcome feedback from our healthcare workers where they found that some of the PPE is of low quality, and those companies, they should be actually dealt with in a manner that they will make sure that they do provide quality PPE going forward. And we have lost 12 educators ever since, 1 administrative assistant from the Department of Education, which is a big loss for us. When we lose our educators, it becomes a big problem. We also this week report we have lost a professional nurse. Like we indicated, as a Gauteng Provincial Government, we like to express our sincere condolences to the family, colleagues, and friends of those deceased, and also express our appreciation to the healthcare workers who have put in effort in trying to save their lives and managing their disease. This is just the indication of the PPE on stock, and will indicate to you that this is what we have on stock. You will see the number continuously go up, because we don't want to get to a point where we don't have enough PPE. In this point, I'll just cover the food aspect of it, that we are approaching a 2 million mark, which will be one of the great needs, a great feat that we would have achieved as the Gauteng Provincial Government. It means these are the number of people that would have touched and also contributed in the food relief scheme that we're having. And our call center continuously gets increased number of calls to make sure that we're able to deal with it. So in the next slide, we're just going to deal with the issues of education, which the HOD will gladly assist us in that regard. Thank you.
No, thank you very much. The progress that we are providing on education would have been in the last week of what happened up to today. However, you may know that the state president yesterday also made announcements of the decision of cabinet at the national level. But what we are giving as progress as at the 23rd of July, without moving away from the decisions that were taken by cabinet yesterday, you'd know that since we had open schools in the province, there had been schools that had to open, but due to cases of COVID that were reported, they had to close. You will see that of the 2,131 public ordinary schools that we had, there were 218 that had to close and be disinfected and open again. Similarly, there are schools that were taking care or that are for learners that require special education needs. And in this particular regard, of the total of 103 schools that we have in the province, we had about 35 of them having to close. And the reasons for the closure of such would have been in terms of the aspects of safety that we have to look at. Similarly, independent schools, we also track, although they would be remaining open as pronounced by the president. We have had to look, and we were able to record that 97% of independent schools in the province had remained open. Only 3% of those had been closed. One of the elements that we always track is that during this time, what is it that happens? While we're opening schools, is there attendance, but is there any teaching and learning that's taking place? Our statistics had shown the number of areas and of attendance, both of learners and teachers, and you will note from this slide where we begin to give an indication that the level of attendance of learners for grade R was at the lowest at 22%, but we had an average attendance of learners for grade 12 at 65%. And you would have heard also that the president in his announcement yesterday, he made the point that we are only going to give grade 12s only 1 week break, commencing, they close today, they go on a break today, from today, and they only for 1 week. And you can see that in Gauteng we had about 65% of learners attending on average in the week that is just concluding. At the level of teacher attendance, in the same way, we would have had the greatest number of teachers attending are those that were teaching grade 12 at 71%, 68% for grade 11. And the reason that you may ask is why such levels of attendance on different days. You would know that there would be either a scare at a particular school and therefore a school has to be closed. But similarly, there would be teachers that would have also applied for that have comorbidities, and we have had to deal with cases like that. What I also wanted to indicate is that as a result of the level 3 lockdown process, but equally where we have had anxieties at different levels of society in respect of the growth of the pandemic, there are many parents that had also opted for home education. And our stats indicate, to this extent, I must indicate that the department ordinarily approves home education. However, in this period, we've also seen an increase in parents that are applying for learners requiring home education, and those numbers begin to give you a number that had applied. What becomes important is that over and above home education, which is when a parent decides to take their child away from school, and they are not registered with any school, but the parent takes responsibility for the education of the child at home. As a result of COVID-19, we have had to deal with what we call lockdown learning. You'd understand that there are learners that would have presented with comorbidities or having underlying conditions, and as a result, should they be mixing or should they be interacting in spaces that are confined, it may create a problem. And therefore, lockdown learning opportunities that the department had provided had ensured that we also, as part of social distancing, but maintaining all the other COVID protocols, we are able to deal with. You will see from this slide that we had received a total of 1,325 applications. So these are in addition to home education applications that parents would have given, and we're giving you the numbers that we had applied, that we have approved, and those that we are currently processing as well. And maybe just to indicate, what does home learning and lockdown learning in our context would mean? In respect of lockdown learning, it still suggests that that learner is still on the register of a school and they are linked to a school. And on a 14-day cycle, a school is required to provide and give a learner worksheets and the relevant work that they've got to be doing. And after every other 14 days, that the learner would then be able to submit that information back, and the teachers would be marking. And therefore, the assessments that the learner does are still controlled and catered for at the school level. So these learners are still on the school registers of those specific schools. But there's a tendency that we have picked up that becomes an element that we want to warn society about, is that as a result of lockdown learning and home education, we have also seen the downside of it, that there have been many illegal schools beginning to mushroom. And we want to warn the public against illegal schools, that we cannot have, parents must be aware of sites that offer tuition, and they offer it under the guise of lockdown learning or home education. And we want those that are operating such sites as well to desist from doing that, because there are clear regulatory processes that we follow in respect of which we can have independent schools applying in the current context. And it is in that context that we want to indicate and guide parents to be careful of these mushrooming entities that purport to be legally registered. COVID-19 cases in schools have been on the rise, but to an extent that we have been able to respond together with the Department of Health. You will see that a total of 1,660 schools had reported a case or so in the province. In the province, we have a total of 2,300 public schools, and you will see that number begins to give you a breakdown. Of that number, in terms of schools, we had just over 1,500 cases of young people that were affected. Now you would ask, what is that number? If you were to, I'm talking of 1,538 in the context of close to 600,000 learners that would have come back. So there are 600,000 learners that would have come back during this period, but only 1,538 would have been affected. In respect of educators, we are talking about 1,308 educators, the number for admin staff we're giving, and we have given a cumulative figure that since the reopening and now up to date, the number of cases that we have had in the schooling system was to the tune of 2,045 cases. And as we indicated that over this period, there are 218 schools that had to be closed and then go through a disinfection process and then be reopened again. Of importance is to know that there have been regulations that we published that suggested that if anybody has a comorbidity or an underlying condition, such a teacher or an official must be able to apply so that they can then, the system can then deal with the necessary administrative processes for substitute and so on. In this particular regard, you would know that it had also been indicated that persons that are over age 60 were also vulnerable, especially when they have underlying conditions. We give you a sense of the numbers that we have had to deal with. In Gauteng, we have just over 3,600 persons on our payroll that are 60 and above, that were in the schooling system, and therefore we have had to address those specific number of issues. The other matter that becomes important is that when the president announced that schools will be taking a break, he said, while we take a break, we are going to provide nutrition for learners that qualify for the school nutrition program. At this point in time, when we started with the phasing in of grades, we started with 183,000 of the 600,000 that were qualifying. The 600,000 came back, but only 183,000 of those were qualifying for nutrition. And you know that there's also a court order that had been issued in this regard. On average, we now are feeding in all of our schools 1.1 million learners. And these are the number of learners that on a daily basis we will still require that they go back to school, that they are able to get feeding, and therefore so that we can deal with the issues of nutrition in that particular regard. What had also become important is that we have been tracking as a system, not only about whether people are coming or whether there is teaching and learning. We also had to look at the well-being, the psychosocial well-being of both the teachers and learners alike. And what we had picked up, that because there were levels of anxiety that were beginning to impact on the attendance at school, and I've shown you the percentages of persons that were coming, and these were emerging trends that we had to begin to look into, and therefore strengthen our psychosocial services to both teachers and learners alike. The one last thing that I want to talk to is that while we are talking about COVID and the closure and the pronouncement that would have been made by the president, it's important to take note that we are also, while we are still in 2020, we are also dealing with preparations for the new academic year. We do know that in Gauteng we have an online application system, especially for grade 1 and grade 8 learners. And these are the two grades in which we make sure that we use an online system so that persons, and the online system is also to mitigate against the effects of COVID, that parents don't have to go to schools to go and apply. They can apply using an online system, and that system we are able to gather that data. Equally, we've also ensured through the system that they do not have to be going to schools to submit documents, as had been the case before. And now they are able to submit documents, they can upload documents online, and therefore it has helped us to minimize the movements and traffic that we had at schools. Why we are raising this is because our online application process closes tomorrow. So for parents that have young people who are starting grade 1 in 2021 in Gauteng public schools, as well as those that are starting grade 8, need to make sure that they go to our education portal and go to www.gdadmissions.gov.za and make sure that they apply to the schools where they would be wanting to send their children to. Chairperson, let me say lastly, following the President's announcement, I think it's important that we reiterate and give indication of the following. That it has been indicated that all the grades that were in school that had returned, and in this case, in Gauteng, we're talking about grades 12, grade 11, grade 7, and grade 6, as well as grade R. All those grades are going on a break. And it's a 4-week break that starts today, 27th July, and it will end on the 24th of August. In the same vein, we do know that grade 12 learners will only have a 1-week break, meaning they will be away up to the 3rd, and they will come back on the 3rd of August. And we know that the grade 7s will have a 2-week break, and they will come back 2 weeks after from today. And lastly, we want to indicate that in the week of the 27th to the 31st of July, that's the period when the teachers and grade 12 learners are going on break, and afterwards, the teachers and learners of grade 12s would have to come back to school to start preparing. And finally, I should indicate that on the 17th of August, because the entire group would come back from a break on the 24th, it's important to also indicate that then on the 17th of August, our teachers would then have to come back to school to start to prepare for the grades that would have been on a break and that are returning. One other information that we have also received, while the President would have indicated that the Minister is going to give further clarification, we do know that there are directions that the Minister of Basic Education had issued, and we will continue to take guidance from those directions that the Minister has issued. Thank you very much. That's all we have for now.
Thank you, HOD. I think maybe we do the closing remarks, MEC, and then we will take questions. Or should we take questions now? Okay. Questions? Let's start here. Okay, can we move the mic over there?
All right, thanks so much. Thanks so much for taking my question. Mari Ketamtlave from the SABC. Just the first question that I want to ask, and which is currently happening, there are students or nursing students that are currently protesting at Linsky Nursing College, just next to Helen Joseph. They are saying that there's the issue of PPEs there, and that's the reason why they are protesting. And the same applies to a nursing college next to Baragwanath. They are actually protesting about the same issue, and we know that these students are actually assisting at these hospitals. Are you aware of these issues, and what are you going to do about it? Thanks.
No more questions? Looks like today we don't have lots of questions. I'm trying to see here if we have any question from WhatsApp. I see there's a question here from Kasi Disabled News. Senzekile. What is the Department of Health doing to bring to bridge the gap of communication between the deaf community and health workers? Okay, yeah, that's the question from Kasi Disabled. These are the only two questions. I don't see any more. All right, we'll answer those and then proceed to do the closing remarks. Let me see.
Thank you. Thank you for the questions. We are well aware of the protest. It started yesterday in Chris Hani Bara College, and it's something that we are working with our administrators in the Gauteng College of Nursing, GCON, to make sure that necessary PPE is provided. There is something that normally we do encounter as it relates to PPE provision at a coalface level. It's just the management of the stock by the facility managers or supervisors at the ward level. And I'm certain that that will be dealt with because we do have enough PPE provided for all our facilities. And this also include for nursing actually students, including our medical actually students that also come into our facilities. But it's something that we'll get report on and see what is the progress from the GCON, because it's a matter that the college itself must be able to deal with in terms of this actually protest. And I think they had given an indication that they will provide and be given something more extra, which we do agree with, that the face shields and the masks are becoming an important aspect of PPE, not only the mask and the apron, but I think just an additional mask. But it's important thing that we do indicate that this is one of our major preoccupation, to make sure that we are able to protect those who work in our facilities or who get training in our facilities. I think the issue on bridging the gap in terms of communication is a big aspect in this regard, and I think we are working, should be working in a project to make sure that it's not only about the deaf, but it's also about people who speak different languages, to make sure that that gap is actually a thing. So we are looking forward in getting the project going and see how we pilot it in one area and see how it develops further and make sure that it becomes the norm in our facilities. The second part on the communication is one that deals with the patients that are COVID positive who are admitted in our wards. We are also working with the civil society and the NGO sector to see how we can be able to put in place a program where the family members could be able to get constant and reliable feedback on their loved ones who are admitted in our facilities. It's something that we saw as a big gap with all the regulations that are coming up on COVID and the lockdown, not allowing a lot of visits. So it's an important aspect so that the families are able to communicate, and those who are admitted as patients, they're also able to give feedback to their families on their state and how they are doing. But it's work in progress. We have spoken to the COVID-19 front, who will come up with a proposal. We have also had a telephonic discussion also with some leaders of the civil society who have actually given some ideas, but it's something that we're working on. Communication becomes important in this regard, and we know that it's one of those that we need to improve going forward. Just to also do the concluding remarks on the media brief, is that ours, as the spread is continuing, as we are in the middle of the storm, our objective, a primary focus, will still be about saving lives. And that's what our comprehensive health response has been all about. We have upscaled a number of activities in this regard, which will help us to minimize community transmission. One thing that is important, that has been expressed as the most important aspect of the work that we have to do, is the one that deals with identification of positive cases, expeditiously tracking and tracing contacts, and making sure that we are able to early put up medical management and intervention, particularly for those who need it. We also need to work towards making sure that making sure that our facilities, in line with social distance regulations, were able to decongest them. So the central medical dispensing system is strengthened. I think we are closer to getting almost 1 million people who will be registered on that actually database, where they will receive their medication at their local pharmacies and also from our community healthcare workers. The other important aspect is just to continue to refer those who require isolation and quarantine for them to be able to get away from where they will exacerbate or help in spreading the virus. And also we are heightening our awareness and our public health education in terms of the prevention strategy. So this still remains the key element of our response, particularly at the level of wards and local municipalities. Also this week, the team, like I've said, visited areas in Orange Farm, which is one of our areas of concern, and where they were able to work with our community health care workers, who were continuing to translate into full-time personnel into the department, and we are quite excited with that intervention. But we are able to visit 1,700 households, and also just reaching over 5,500 people in that regard, and doing a whole lot of health screening, not only COVID, but also HIV, BP, hypertension, and actually diabetes. And this is something that we are doing with help and work with COCTA, the Department of Cooperative Governance and African Traditions. And this is what we're hoping that it will be scaled up with all what we have been doing. We know that the President has deployed ministers and deputy ministers into our provinces and all the provinces. And next week, when we go on to this work, it will be led by the ministers as outlined in the slide there, where Minister of Defense, Ms. Nosiviwe Mapisa Ngakula, will be based in Johannesburg doing the work with the MEC Lusufi and MEC Mukhethi in Johannesburg. And in Tshwane, it will be the Minister of Public Enterprises, Mr. Pravin Gordhan, who will be joined by the MEC of COCTA and Human Settlement, which is Leboang Maile, and the MEC of Infrastructure Development and Property Management, Ms. Tasneem Mutara. In Ekurhuleni, it will be the Deputy Minister of State Security, Mr. Zizi Godwa, joined by MEC Ralihuku of Finance and MEC Mamabulu of Roads and Transport. In Sidibeng, it will be Minister of Education, Ms. Angie Motshekga, will be joined by MEC Community Safety, Ms. Mazibuko, and MEC Sports and Arts and Culture and Recreation, Ms. Klope. In West Rand, it will be Mr. Figiles Majola, who's a Deputy Minister of Trade and Industry, joined by the MEC of Health, Bandile Masuku, and MEC of Economic Development. So these teams will be leading all the ward-based teams in all the districts, doing the actual work that we would want to be doing in terms of screening, in terms of testing, in terms of all the health care actual screening that I spoke about, hypertension, diabetes, HIV, including COVID, and also making sure we're tracing our contacts and knowing that knowledge. This is our effort in making sure that we continue to improve our work on the ground in relation to the ward-based approach. And yesterday, we also welcomed the revised allocation of the budget, which will continue to bolster our fight against the pandemic. And a lot of work has been put into place in terms of adding more hospital beds, getting more equipment and adding more staff, and also purchasing more PPE. This is a work that we continue to report on to the Gauteng public, and making sure that we are all abreast on the progress that we are making. And this is work that could have taken us over 2 years, but it's taking us a very short space of time, which is 20 weeks, to be able to deal with it. We have been able to add over 2,418 beds, and we are still going to add 5,200 more beds. And we are also continuing, like I've said to you, that we are continuing to appoint health professionals. We have already appointed to date over 994 health professionals, and we are still going to continue to employ more in the second phase, particularly in the spaces of field hospitals, which we are continuing to actually put up. We also welcome the help and assistance from the South African National Defence Force personnel, who already has been on the ground in most of our facilities in the province, and it's work that we continue to do. And the personnel, as we're approaching the peak and we are in the middle of the storm, we need to continue to control the spread and make sure that we play our part as responsible actual citizens. We know that the primary spread of the virus is due to movement from person to person or surface to person, but it's an important aspect that we maintain the general rules that we have been said. We continue to appeal to everyone to maintain, wear a mask when you go to a public area, keep a physical social distance when you're in public spaces, and we also want to continue with the golden rules of washing your hands and when you can, and continue to sanitize them and keep them clean. And this is what we hope that all the South African citizens and Gauteng residents in particular will continue to uphold. Let us continue to adhere to these measures because they contribute in curbing the spread of the virus. Yesterday, we joined in a collaborative seminar where Dr. Fossey from the United States took part in a webinar with the MAC. One of the important things that they stressed was that the basic way on how we are going to continue to stop the spread or reduce the rate of the spread of the virus is just to continue to uphold these golden rules and these social and non-pharmaceutical measures against the pandemic. As we battle this virus together, we should stay socially connected through non-physical means and making sure that we contribute to our social well-being, our mental well-being, keep in touch with our loved ones with phone calls, video calls, and also messaging. And it's an important aspect as the Gauteng government, provincial government, to also indicate that all of us, we do have a role to play and we need to play our part and we stop the spread. Thank you.
All right. Thank you, MC. I think, yeah, we've come to the end. Thank you very much. We will again next week.